But if we stop there and we think, what is this dynamic correspondence? And some of those movements, as we went over, you're probably thinking, yeah, I see that, and some of them probably not. It's like, how does a bicep curl help you do your dribbling? Probably doesn't, even though it's the same pattern. But dynamic correspondence, so trying to enhance that transfer of training, there's three criteria for it. And that's that the exercise duplicates the same neuromuscular pathway as seen in execution of the competitive skill. The second criteria is the exercise develops strength over the same range of motion as is displayed in execution of the competitive skill. And the third is that the exercise duplicates the same type of muscular contraction as seen in the execution of the competitive skill. So these three things need to be around to have a high degree of transfer. Some of the leg raise that it mentioned earlier. The hip flexor is absolutely involved with driving the leg forward from the back to the front whenever you're doing sprinting. So going from plantar flexion, plantar flexion as you near the push-off phase, and then the other leg is touching down, and you're restarting the gait cycle in that first leg. Well, the hip flexor obviously turns on and will drive the leg forward. However, it's not at the same rate of contraction the whole time. It starts from a very, very extended position where the femur is in hyperextension and you're in some lumbar extension. It fires quickly and very forcefully, and then it kind of backs off, and it allows the momentum to carry through. Well, on a leg raise, typically you're doing slow and controlled, going from full extension to as close to full flexion as you can get with the joint at that range. We see how those contractions are different. A forceful, brief, fast contraction, the start of the sprint, versus a slow, controlled contraction from about half of the range of motion that would be occurring. So we probably wouldn't see that great of a gain from a simple leg raise. You could do the knee drive exercise with bands or a weight stack and see a pretty good improvement on that. But that goes into general versus special exercises that we could talk about in a different lecture. We need to look at the movement analysis of the sports. What is the muscular balance? What are the agonists? What are the antagonists? What are the ones that are doing the work? What are the ones that are slowing it down? And we also need to look at exercises to promote recovery. These do not involve high muscular stress or high stress on the nervous system. They promote movement and restoration. We need to make sure that the athlete can go through full ranges of motion so they aren't getting hurt by trying to compensate at other joints. Now, along those lines, I like to look at what are the causative factors of injuries within that sport. So an example that I often give is that my first team that I was ever given was a women's soccer team. And I knew that the ACL was a common bad injury, so I thought if I strengthened the muscles around the ACL, that they would, around the knee, that they would prevent the incidence of the injury. And I was wrong. We kept seeing the same incidence rate. Then I was sitting in class and happened to come across a paper about the mechanisms of it. And at the same time, I was in kinesiology and saw what muscles cause those actions. So I thought, hey, if we strengthen the opposite, maybe that'll help. So I found out that the mechanism of the ACL injury was hip adduction with internal rotation and anterior tibial translation. So what do we do? To decrease the risk of injury, strengthen the opposite of that mechanism. So strengthen the abductors, external rotators, and tibial posterior translators. In this instance, hip abductors would be like the gluteus medius. The external rotators would be the deep six. And then the tibial anterior translation, the posterior translators are typically, we've got the soleus as a secondary factor, but we've got the hamstrings in a closed chain action. We're going to posterior tibia translate the tibia through their knee flexionability. So there you go. Whenever we improved that and we focused on that, we saw a decrease in ACL tears. Now, the movement analysis of the individual. We need to look at fundamental movement patterns. How do they move? Simply. We typically do screenings. And it doesn't matter what the screening is. As long as it's something that is valid and is reliable, it doesn't matter. There's people in different movement camps that are firing shots at different screens, and honestly, I think we're pole vaulting over mouse pads, as my dad used to say. If the screen looks at range of motion, balance, and interlimb asymmetries, you're set. Most of the time, people are going to be a little bit asymmetrical, but you want to look and make sure that they're within reason. Uh, do they have appropriate range of motion? If somebody doesn't have an ability to dorsiflex and they're in a sport that requires a lot of change of direction, they're going to need to work on that. Uh, and again, I want to, not again, but I want to point this out that we're dealing with screenings. We're not dealing with assessments. So we're not trying to find out what's wrong. We're just seeing, can this person do things reasonably well enough to train? If it's not right, if they are very, very poor, refer out. See what that reasoning is. Don't think that you can correct everything. One of the examples I often like to give is I had the benefit of working in a PT program, physical therapy program, as an assistant, an associate professor. There was a lot of things that I knew as a strength and conditioning coach about dealing with back pain. And so we knew about mobilizing the hip and strengthening the posterior tilters of the pelvis and bracing it, and on and on and on. But one of the things that we weren't trained is to how to recognize when and what areas of back pain were signs of colorectal cancer. As a physical therapist, should know. So this is why I always say, if it's not right, refer out. We're doing a quick screening. We want to make sure that if the athlete can participate in your program or not, or if they've got anything that's huge and glaring. And if whatever you do to try and fix something doesn't work within a couple of weeks, either try something new or refer out. What is their exercise technique experience? Do not assume that an athlete will perform an exercise correctly. If there's any doubt, have the athlete demonstrate the exercise and provide instruction as needed. It's really easy to get people hurt by doing exercises with improper technique. So we want to make sure that they're able to do it. If I had a nickel for every time that I had an athlete tell me that they've got great squat technique, great clean technique, can bench 400, squat 600, and clean 350, I'd probably have at least $30 in my pocket right now. I don't. Never assume, never take anybody's word for it. We also have to know the availability of the resistance training equipment. And not only what equipment that you have, but is it going to be available at that time? If you work in a strength and conditioning facility that's not a private studio, there's often going to be multiple groups training at the same time. So you need to be able to coordinate who can have the racks, platforms, etc. whenever they're needed. It doesn't matter if you want to do heavy back squats if another team is in there using that equipment. Another example that I've got is my mentor's mentor was a coach by the name of Fred Roll, who was at Kansas way back in the day. And he designed a weight room that was absolutely gorgeous and had fantastic facilities. However, when he got let go, he went down to the island of Tonga and became their strength coach for their rugby team. They did not have a weight room. They did not have barbells, plates, or anything. They had palm trees and coconuts. So he fashioned a program around those and tons of sand that they could pick different things up, progress in loads, and do things that way. So it doesn't matter what you want to do if you don't have the equipment to do it. So start off there. It's all about logistics. Start with your logistics. Figure out what the schedule is going to be and go from there. And the available training time per session. Prioritize time-efficient exercises when time is limited. As I mentioned, I only had 30 to 45 minutes to train with the soccer team. We didn't do Olympic lifts. We would do some of the derivatives, some of the pulling exercises, but I didn't have time to teach them to catch, so we never did it. I prioritized the time-efficient exercises. We did things that were big rock. We would do jump shrugs, squats, glute ham raises, RDLs, etc. Exercises that would show us the biggest bang for the buck.